So recently I had a client who suffered badly from OCD. There's lots of intrusive thoughts around her new family, and also a lot, and I mean a whole huge lot of scrubbing every possible surface in her home continuously. And it was really, really getting out of hand badly. And as you most likely will be able to imagine, it also affected her life in a big way. Not just her life, but also her husband's and also her children too. And it went to a point where one of her children, and I think she said that he was, if I remember correctly, he was around 3 years old, he started acting and reacting in similar ways to her, which she didn't feel comfortable about. And she decided then and there, that's when she wanted to start taking action. So it can be a great motivator, you know, when you're stuck and you loved your loved ones, you love your loved ones so much that they become your motivators. Sometimes it's hard to take a step back and take a long, hard look at yourself and to make that decision to start to make changes, to take action. Sometimes you're in such a deep survival mode, frame of mind, that you simply can't even look in any other direction than the one you're heading towards, and you don't even consider taking actions. And this client was very fortunately motivated by her young child. So she decided to start therapy, and over the course of a couple of months, she tried all sorts of things. Also medication. I'm not sure about the details of which medication she used, but she tried many different things. Amongst others, she tried exposure therapy. And what she decided to do, as was suggested during one of her exposure therapy sessions, and really I think it's a pretty brilliant thought, she decided to take part in a Mudmasters run. And that seemed to her to be, you know, the sort of ultimate challenge, as she really hates absolutely anything to do with dirt. And although she genuinely enjoyed the Mudmasters run, unfortunately, she was extremely disappointed to return home. And all of her signs and symptoms of her OCD were still very much in place. And her dirty shoes and her clothes, I think she said that they went straight into the bin. And she, upon arrival at home, had to clean her car out multiple times, as you know, some of the mud had travelled along with her. And as you can probably imagine, she was just extremely disappointed by that. And also, beside being obviously disappointed, she was also rather surprised. I remember her telling me that she was absolutely elated in the car, chatting away to her friends who had joined her on the way back from the Mudmasters run. And after she dropped all of her friends off, she was feeling super proud of herself. But then at one point, there was sort of a turning point that led her straight back to her, you know, her old self. So what changed? And when exactly did it change from the drive home from her friend's house to the moment she arrived home? So I asked her these exact same questions. And she remembered that the feeling stuck around, you know, that elated feeling, it stuck around for a wee while during the drive home. But it did seem to change as soon as she drove up her driveway. That's when the anxiety and the tendencies really started to rush back into her thoughts and into her body, physically even. And that's interesting because her behavior changed as soon as she came home. So why wasn't it a problem before? Why was not a problem to her, you know, to have all these dirty clothes and shoes lying in the back of her car? Why wasn't it a problem for that hour or so long drive? But all of a sudden she had to clean out the car from head to toe before even entering the house. She had to clean absolutely every surface in the house after taking a shower because, you know, potential dirt somewhere hanging around in her clothes that she walked into her house with. So she was very upset about that because she wanted to celebrate her breakthrough with her family. They were all waiting for her arrival, and instead she went straight back into frantic cleaning session mode before she even properly entered the house. And then she still wasn't available to her family because, well, she had to clean the house, she had to have very, very long shower. You get the story. But imagine that feeling of failure, of disappointment. Her intrusive thoughts after that completely spiraled out of control. I remember her telling me things about seeing herself and her baby choke in the mud, and it's horrible. So it had the exact opposite effect in the end of what she was hoping for. Being so hopeful about the result and being so focused on it, and then it doesn't happen. And for her, it ended up getting a lot worse even. And that really sucks. But I'd like to backtrack a little bit here, because maybe you remember saying we asked her the question, when did it change? When did that euphoria transform back into dread? And that's where we had to start sort of looking for some very interesting clues. Why did her OCD tendencies stop during that muddy and very dirty experience? Why did they return with a vengeance when she arrived home? And we started a bit of a quest of when and where her tendencies happened. And as she hadn't left the house very, very often since having her second baby, which was when her OCD tendencies started, it was after a very traumatic home birth. That was where she had spent most of her time for the past year or so after having her baby. But what happened when she did get out of the house? So that's what we sort of started to talk about and try to find out. We talked, amongst others, about her job, which was mainly in an office building about, I think, 20 minutes down the road from her home. And she didn't feel the need to clean her office space continuously. She would keep it clean, but she didn't feel the same need as in her own house. And she was able to do things like, use the toilet, for example, without having to scrub every surface down before and after use. Again, it was mainly in her own home. She mentioned when out for a meal with her partner or friends, or when she was shopping, or even when she was out for a family outing, she didn't feel the need to do all these things that she did do at home, not to the same extent anyway. And funnily enough, when she went out for a week and a half with her family to a nice rented cottage, she didn't experience that same level of her OCD tendencies. It was there, but it wasn't half as strong as in her own home. So that was a very interesting clue. It's a very important clue that, during her quest to look for answers into where does it generally happen most, and when does it happen? When doesn't it happen? Or when does it not happen to the same extent? What are triggers? When are triggers there? And when are they not there? And that's where many therapists out there, they sort of open their toolbox with lots of great ideas and tips and tricks and meditations and visualization. And I'm not saying that they're useless. Don't get me wrong. Far from it. But what I would like to say is that very often they can be sort of generic, and they will use things like scripts, tools, ideas, suggestions, all coming from textbooks. Sometimes they forget to really, truly, deeply look into the individual. And in this example, had that therapist or one of the therapists who'd been to see dug a little deeper, then they could have potentially made an educated guess that the mud masters would be fun, but it wasn't the remedy. And that's what they were hoping for, since this client wasn't experiencing her symptoms in all places, basically only in and around her own home. But this client was so involved in her own thoughts that she hadn't considered this, but neither had the therapist that she had previously been to see. And my client and I together, we were able to start to sort of unravel those big knots that she was caught up in. And I can very proudly say, very gladly say, that I spoke to her the other week, and she is almost completely free of intrusive thoughts. And although she still really likes her house to be clean, don't we all, especially with children, she is now much happier and much more relaxed to let go of that obsessive cleaning, and has exchanged even some of the time spent scrubbing for a bit of me time and quality time with her family. I'm just so proud of her. That must be so wonderful. And it just goes to show, you know, we're all individuals and we all have our own unique set of skills and tools, our own circumstances, our own unique problems and issues in life. And by not generalizing our problems and issues just because we want to give it a name, like it's OCD or it's anxiety or it's postpartum depression, sometimes it can be really helpful to label it, but sometimes we need to look beyond these words and really look in depth at our unique and personal situation and experience. And especially what we discovered here, you know, may just help us along in our journey to better health and happier life. And yes, many sufferers from postpartum anxiety, postpartum depression, postpartum OCD, they have many similar signs and symptoms. That's true. That's where the names come from at the end of the day. But we all have our own unique experience in life, our own rucksack with all our feelings and everything that's happened to us in our life, our own unique motivators to help us up and demotivators, detractors that get us down. We're not all the same in that respect. And therapy should not be one size fits all. And that's what I find so important during my sessions, to look at you. Because at the end of the day, you are unique and so are your problems. And you have all the unique clues that can lead you away from the problems. So maybe that medication developed for people who have similar signs and symptoms won't help you. And maybe reading out that script or listening to that recording aimed in general at people with potential similar signs and symptoms, maybe it will help you, and maybe it'll help you to a certain extent along the way. But by not catering to your individual problem and your unique situation, there is a very good chance that therapy becomes very hit and miss. And, you know, before you know it, you've become absolutely frustrated with all the time and money and energy that you're spending on things, and you keep reproducing this story about everything that's happened. And it all sounds so good, but it doesn't help you along far enough to resolve your issues in the long run. Now, I really love this session and the insights that it gave my client, but also the insights that it gave me. She even talked me into trying to join the Mudmasters, but we'll see about that. If I do ever decide to do it, then I'll be sure to make a video of it. I hope that's what you needed to hear today. If you feel you need to get in touch with me, please do. I'm there for you. Take care.